Hello, everyone. I'm Stefanie Jones, and I am here to talk to you about health and wellness in the night economy, which is an incredibly huge topic, which I am not at all going to talk about in a comprehensive way, but I'm going to talk about health and wellness in relation to alcohol and other drug use, which of course is the topic around nightlife that we always sort of acknowledge and slide around to the side, but I'm here to talk about it for 20 minutes. You know, the drug stuff right before lunch. Hopefully this will be pretty lively. A little bit about where I'm coming from. So I work for an organization called the Drug Policy Alliance in the United States. We are a national nonprofit. We're an advocacy organization, so we're the people that are working to change drug laws. We work across the whole spectrum of drug policy reform, so we're doing things like we've been behind most of the medical marijuana and marijuana legalization laws in the United States. Congrats to Canada, by the way. Very important news with the legal sales beginning here. And we also have done a lot of criminal justice reform, so rolling back mandatory minimums, which require people to go to jail for long, long sentences without considering the circumstances of their arrest or their case. And we also do a lot of work in health and harm reduction, particularly around opioid use and addressing the opioid overdose crisis. So we do things like promote syringe access and the overdose reversal drug naloxone and other things like that. And the final area, which is an area that I work particularly in, which is about engaging young people, educators, parents, and just doing general drug education about drugs and drug policy. So I've been at Drug Policy Alliance for a long time, over a decade, and I have started a program within DPA called Safer Partying. And the goal within Safer Partying is to make sure that within nightlife and festival spaces, we are taking a health-based approach to alcohol and other drugs. And I do that kind of in three work areas. So I make a lot of publications and stuff that can be shared with venues and festivals to be distributed. I also work directly with event producers, and I do some direct service work, like putting together teams that go out mostly to festivals and do drug education and support. I also help these festivals with their messaging, because once a festival or an event decides they're actually going to address the issue of alcohol and other drug use straightforwardly, they often don't know where to start. So I help them with developing some language. And then when we run into barriers, wanting to do a certain project or a certain initiative, but there are blocks to making that happen, then me and my colleagues within DPA are the advocates that show up and say, you really need to change this. So I love my work. I'm a nightlife patron myself, and so I feel very lucky to be able to talk to people like you about it and get paid for it. But the real question is, why is this important? Why are we dedicating some time to this in our conversation about the nighttime economy? So it seems like it should be a pretty obvious answer. I mean, the industry itself is so much based on alcohol sales, and we can also acknowledge that other substances are being used as well. But I did want to put up at least one data point that kind of underlines something that we already know. Is anyone familiar with the Global Drug Survey out there? Anyone? I see a couple hands. The Global Drug Survey is an online survey that is not attached to any government agency or any university. People can opt into it, and they then get asked a bunch of really, really nosy questions about their drug use, like really comprehensive. So if you're the kind of person who is to use substances and take notes about it and make dates, please take this survey. It's been going on for a while, and the really useful thing about it is that they always ask a question about people's, whether or not they go out and how often they go out. And if you can see from the slide, they have a very conservative definition of what constitutes a quote-unquote clubber. So that's only 4 times a year that you have to go out to a show or a concert or an event. So if you have been here at Nova Scotia Music Week since Thursday and you're staying through Sunday night, congratulations, you are in this category. So what they ask, though, and what they have found pretty consistently, this is data from 2017, is that people who are going out in nightlife spaces generally use a range of substances more frequently than people who are just out occasionally or don't really go out at all. So this data, again, is from the United States, and it's a year or two old, but I did check in with the person who did the survey, and it's consistent. I have the Canadian data. If you guys want that, you can talk to me after the fact. But again, the point here being, this is absolutely an issue that we need to think about as part of what we think about when we address the nighttime economy, because it's very much a part of what happens, not just for attendees, but also the artists and the people who work at the venues. So I'm going to try and quickly go through three areas where I think there's a lot of opportunity for intervention and talk about some examples, primarily from the festival space because that's where most of my experience is, but I challenge you to think about how it might be relevant in your particular context, whether you're an artist, venue owner, city government, or what have you. I'm going to talk about raising awareness and education related to alcohol and other drug use. I'm going to talk about support for mental health and personal crises. And then finally, I'm going to talk about drug checking to prevent overdose and medical emergencies. Okay, so how many people out there have heard the phrase harm reduction? Okay, good, a good category of people. The harm reduction philosophy is just, it is, in my opinion and the opinion of my organization, it's the most important, most reasonable approach to alcohol and other drug use. It starts from this place of just accepting the fact that we are not living in a drug-free world. We will not ever live in a drug-free world despite the wishes and aspirations of many government entities. And we need to acknowledge that and sort of deal with the reality of that as it is, which I actually think that people in the nightlife industry are pretty good at. And so harm reduction is just about, first of all, acknowledging that fact and then finding ways to identify what the risks and the harms are and then thinking about what we can do to respond to them. So all three of the things I'm going to talk about have sort of a harm reduction philosophy underpinning them. So the first one, my personal favorite, is education and awareness. It's super, 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 super basic, and it is not done as often as we might like. There's been people talking about it. There's a lot of young people in nightlife spaces, whether or not they're of legal age or whatnot. Like, the fact is, we're all out there in these contexts. Drugs are around. They may or may not being used, and people don't often know very much about them, especially young people. And so, young people start going out to venues. This is where they first, can maybe get their first drinks or whatever else might be available. And they often come into these spaces with very little knowledge about what drinking is going to have an impact on you or what any other substance is. So that makes it really important to think about nightlife spaces as a context for where this education can take place. The important thing about this education, of course, is that, we've all gotten sort of the just say no, like, don't do this kind of messages, and they haven't been very effective, and people don't really respond to this. So again, going back to a harm reduction philosophy, you want to make sure that if you are going to address drug use, that you're doing so in a way that is presenting information that's accurate, that it's not judging people for what they do, which is, easy to say and hard to do, because we all carry judgments about somebody using this substance or, doing that thing. It's really, really important to try and keep that information on a non-judgmental level. And it's also really important to make sure that the language is accessible and approachable to who you're trying to reach. So I'm a big fan of working with, your local public health or other entities that might be excited and want to do this work, but you don't want to necessarily make your communication campaign sound like it's coming from them. Like if you're aiming for young people who are going out at night, like the best practice is to have other young people speak to them or like use the language that folks are used to hearing. So that is, that can happen, of course, at like in a publication, like on a written level, or you can have young people themselves out in these spaces having conversations with each other about how to be safe if they're going to be drinking or using other drugs. So I have an example from Safer Partying Work. I brought the little flyer here. You can't really read it, but it says help save a life, and it has tips about how to recognize a medical emergency or overdose with alcohol and 4 other commonly used substances. It also has safer use tips, and I was able to put this together with New York City's public health department, so it was a really great partnership. And to be honest, they were the ones that put the safer use tips in there. So I was working on getting this into a festival, and it's a really great way to start by just saying, hey, look, we don't want anyone to die. It's great that you have your medical staff on site, but we need to educate and make other people aware of what the risks are and what the signs are. Here's something that can help. So that was the starting point, and then adding on, hey, by the way, it's always safest not to use a substance, but if you're going to, here are some ways that you can potentially make it safer. So we were able to put that together, and I now send it out to festivals to distribute at their info stands, whatever it is. Obviously, even better than that is to get the, fine young people themselves out there talking to people, distributing it. So I have examples from a couple of festivals in the US. And even better than that is to have a chance to train them actually on the content so that when they are engaged in these conversations, they're speaking from a place of knowledge and they have the tools that they need to have really effective conversations with other young people. I'm a big proponent of going beyond just the paper and the in-person approach with your educational campaigns. I mean, every day, people are on their phones. People are on their phones right now. That's okay. Hope you're tweeting. And then when you're on your phone, you're on social media, right? So this is a way to reach an even larger community. And if you're thinking about like a shorter term show or like a club venue where you might not have the space to have like a setup, using your social media is a great way to reach a larger group of people. Does anybody know the festival Lightning in a Bottle that I'm showing up on that slide there, all the way in the back? Only one person? Okay, so Lightning in a Bottle is a festival in California that has really, really amazing harm reduction services on site. They hadn't yet really, it was amazing because they had them on site. They were doing the right thing, but they weren't really telling their attendees about it. So I helped guide them on like, this is what you want to do. This is how you talk about your approach. And they directly sent out some stuff to their followers about this is what we do. So earlier when Stacy and Ashton were talking about like, what's your code of conduct for safer spaces? This is a similar kind of idea. Like tell your attendees what your approach is. Tell them that you're using a harm reduction approach, what services you have on site, that kind of thing. And then, then they tweet out information from their groups on site, which then is retweeted. So it's a nice way to build on it, on each other's work. And it really, again, spreads the impact of this kind of communications campaign. So the next thing that I want to talk about is peer support and mental health. One of the things that we can also acknowledge is that people walk into nightlife spaces with all sorts of situations that you have no control over before they walk into the door. People could just be having a really bad day, or they can be dealing with challenges like around depression, anxiety, any sorts of things like this. Then you put them in a context like a club or a show or a festival, and you add alcohol and other drugs into the mix, and things can get a little messy. They can get a little intense. So from the festival kind of context, what has been done is some festivals have created these spaces that are like chill out spaces or, safe zone kind of places. And they staff them with people who are trained to just provide support for somebody who's having a difficult experience. So again, this is not a medical situation. So this is actually kind of functioning as sort of an adjunct to medical. Because a lot of times people like get brought into a medical space, they're freaking out or whatever, but they're not actually having a medical issue. There's nothing that like a medic can do for them. So that's where a place like this comes in handy. And the person can just be like, you know, provided compassionate support. Hey, what's going on? You know, how can I help? Let me just sit with you here, whatever it is. It's a way to make your space more welcoming, friendly, safer, and it's really going to make a difference in how your attendees feel about their experience at this show. So sometimes you notice that I barely even mentioned alcohol or other drugs there. Sometimes that's the case, like somebody just out of their head, they need to like sort of have somebody else be there and keep an eye out on them. But sometimes somebody just got like lost at the festival. Sometimes they just, you know, broke up with their boyfriend or whatever it is. So it's just like a nice service to add. Again, it's a little bit more relevant in festivals where it's going multi-days, but in a club space or a bar or whatever, to think about like having a staff person, at least one or two, that are trained to like provide this kind of support is a really great way to start integrating this into your health and wellness plan. I'm not going to go too deep into this, but I did want to show you how sort of basic and easy place to start on understanding these peer support principles are. These are principles that are borrowed from a group called the Zendo Project, which is in the United States. They categorize it as psychedelic harm reduction because they work a lot with people who are using psychedelics. So this is also kind of known informally as trip sitting. But one of their principles actually is that you're sitting, you're not guiding them. You're not solving their problems. You're just providing like that space to just have people, you know, get where they need to be so that they're not like, so they reach like a calm center and they can go back out and participate in the festival or club or show wherever they are. So I won't go into that, but it is something that's really easy. They have 4 principles that they use to guide people. And so it is something that bar staff, club staff, whatever, can pick up relatively easily. The other thing I want to talk about, of course, is the flip side of this. So that was talking about mental health and sort of crisis response from an attendee perspective. But the other part of this conversation around mental health is that the people who work in nightlife, of course, face these same challenges. So everything that I just said about somebody who shows up to an event is true of your artists, of your venue staff, of whoever else, but they have the additional challenge of like they are in their workplace environment. You know, this is not like extra time. This is their livelihood. So there are additional challenges and stresses associated with that. And the little image that I put up there on the slide is actually it's actually a very recent survey that came out. There's a organization, or it's actually a ticketing agency company in the UK that surveyed people working in promotions, and that figure at the bottom says that 80% of the people that they surveyed in the promotions part of the industry were experiencing consistent depression, anxiety, and stress while they were doing their job. So that is a really daunting number. This is obvious. I think this is the beginning of the conversation, and to be honest, my organization doesn't work as directly on it, but just as another aspect of health and wellness for you to consider when you're making your plan or thinking about the nighttime economy, this is absolutely a huge, huge area. And it's something that is needs to go beyond the sort of crisis response when you're dealing with an attendee and more thinking about the structural responses. Like, what are you doing in your club venue at your show to make sure that the hours are reasonable, that people can get healthy food and drink, that they have non-alcohol alternatives to beverages, that kind of thing. So that's a really important part of the conversation. The last thing I want to talk about is drug checking. Do folks in the room know what drug checking is? Anybody familiar with it? Few hands there. Awesome. I love to tell people about drug checking. So one of the things that is a reality of our drug market, of course, is that most substances are illegal, which means they are unregulated, which means that anybody could be producing them, and anybody can be using whatever products they like. This is obviously a big risk of using drugs that are illegal. And drug checking is a tool where people can find out a little bit more information about what they might be taking. So somebody has a substance, they think it's something, now they have access to a way to test it to find out if it is what they think it is. There are a lot of different ways that this happens. There's a way just you as an individual in the room can do it. There are little liquid reagent kits where you essentially take the substance, take this tiniest, smallest amount of it, drop a little drop of liquid on it, and it will have a color change, which tells you what's mostly present in the substance. And there's a picture of that happening at the bottom of the slide, which is actually from a festival in Canada, in BC, called Shambhala. Are folks familiar with Shambhala? Anyone? In the back a little bit? Shambhala is fantastic. They've been doing drug checking for many, many years. They are on private land, so it makes it a little bit easier. But the good thing is there are a number of different ways that it can be done. So again, the top images that I have there are actually from Shambhala. They have a whole setup devoted to harm reduction. They have the signage associated with it. It's a very well-known feature of this particular festival. And I hope you can see on that photo that there is a huge line of people that are waiting for this service. So it's definitely something that is needed and wanted within these spaces, and people will use these services when they're available. In your particular context, doing something like this may not be a reality, so I wanted to show like some other options, which the bottom part is actually a mobile drug checking unit. If you can tell from the picture, they actually use a little bit higher tech equipment to do their testing, so they're able to give a little bit more specific results. And this is an image from a mobile van that does drug checking in Vienna. There's a lot of different drug checking projects that happen in Europe that I won't go into, but if you want to nerd out with me after the talk, I'm happy to do it. But it's just important to know that if this is, doing an on-site sort of drug checking thing is not a possibility for you, there are other ways, like with the mobile van. I've talked this whole time without sort of acknowledging the fact that drug checking makes a lot of people nervous because you have to have the drugs like right there, out there, everybody can see them. Makes folks nervous. So in Canada, I'll focus on Canada because there's some really cool stuff happening here right now. The main laws that would prevent something like this happening are, of course, drug possession and drug transportation, aka sales laws. The way that drug checking has been able to move forward is that some certain sites that are designated as overdose prevention sites are given an exemption from these laws. And these are mostly sort of associated with syringe access places where people using opioids and those kind of drugs use and get services. But because of the opioid overdose crisis that is happening and just the number of deaths that have been occurring, this has actually galvanized many provincial governments across Canada to do a larger number of these trials and to do this in more and more spaces. And the reason I'm focusing on Toronto is because they have a project that's in development that will be centered at community centers. So community centers in downtown Toronto that are going to be accessible to anyone, to young people and to people who might be using drugs in nightlife spaces. So that project is kind of in the works now, and it should be fully operational by April of next year. So that is really, really exciting. So I just want to have everybody keep that in mind as an option, even if it sounds crazy and like far-fetched. This is kind of like the new reality of where we're moving towards. I have to give a shout out to my Canadian colleagues because really any one of them could be up here giving this presentation, and I do hope they come back to Nova Scotia Music Week and other conferences like this. But I just wanted to show that this work is actually happening. And so for those of you in the room considering doing it, like, you definitely don't have to do this alone. There are a lot of groups across Canada that are doing this work, and I actually didn't even get all of them on the list because some of them emailed me late and get them on there. There's one in Calgary, Party Safe Calgary. I think there's one in Manitoba. I wanted to mention Manitoba because I didn't get it on the list, but it is happening, and so I strongly, strongly encourage you to reach out to these groups if you're working in any of these areas. Some final thoughts. This is coming back to like my policy advocate sort of background. So I just went through the 3 sort of areas to consider when you're talking about, or when you're thinking about alcohol and other drug use in spaces. A lot of barriers still exist to initiating some of these projects, or people feel that barriers exist. And so, and I guess this is my shout out to any city government folks out there, but it's important to make sure that we remove these barriers, because all of the things I talked about are about taking a health-based approach, a realistic approach to alcohol and other drug use in nightlife. So that's an important first step as you go down the path of initiating these type of services. And then second thing, which you just saw the slide about it, but to reach out and partner with local community groups and nonprofits. Like, I love the music industry sort of DIY attitude, and I think that's amazing, but we can all like build together when we work together, like much more powerfully. And so I definitely encourage folks to do that. And then third, and I know this is also the part where you get through, you like remove the barriers, you've done the project, you've got the partners, you put the thing out there, you're so excited, you're giving yourself a round of applause and congratulations, but you can't forget to check back in and see how that project is doing. That is a crucial aspect. And I know that personally I've learned a lot when I've done my safer partying work. The feedback that I get from, the young people that I'm speaking to or the event producers that I'm working with helps me improve and make even better outreach tactics going forward. So that is a super quick overview. I think I did it in the right amount of time. So thank you, and I'm happy to talk more about nightlife and drugs, 2 of my favorite topics, any other time after this, and take questions if we have time for it.
Thank you, Stefanie. I think we do have time for one question, if anybody wants to ask, but again, Stefanie's going to be about.
It's not so much a question, but it kind of ties into the morning's discussions as well about having the right partners at the right time in the right places, because there was an incident here in Nova Scotia with a very popular music festival who wanted to put drug checking policies in place. And 4 days before the festival, the town was ready to pull their liability insurance, and it was a huge uproar, and the festival actually ended up moving to another province. So it's a great example of people who are trying to take the right steps, do the right things, but when the policymakers are coming up, I didn't mean to point at you directly, you had nothing to do with it. He just happens to be a policymaker. Yeah, it's his idea. I just volunteered to tell you about it. But it's like a very clear incident of sort of a mash of ideas that just aren't working together. So it really reflects the importance of people coming together from different backgrounds to make sure that these things happen.
Yeah, absolutely. And I'll just say quickly to that, there were a couple of festivals in BC that actually managed to have their festivals designated as a sort of temporary overdose prevention site. And that over this past summer was how they were able to do drug checking, but it absolutely wouldn't have happened without the partnership that they had with BC health organization.